my name is Kimberly and I will be talking about acute pancreatitis. So first, I would like to share some information about my specific patient with you. So I had a 44-year-old male with severe abdominal pain that presented to the ER. He reported a moderate amount of abdominal pain for the last 3 or 4 days with frequent episodes of nausea and vomiting, and he was unable to keep down any foods or liquids. The patient denies recent alcohol use with this admission, but admits to making unhealthy choices regarding his nutritional intake. Some background information. 2 months previously, the patient had a recent admission for alcohol-induced acute pancreatitis. At that time, he reported a history of alcohol abuse and stated that he had drank prior to that admission. Some pathophysiology and etiology. So acute pancreatitis is defined as an acute type of inflammation to the pancreas. The inflammation can range from various forms. It could be a more mild form of edema to necrosis by hemorrhage. So when the pancreas isn't getting enough blood flow, it's lacking that oxygen and the nutrients it needs to thrive, which causes cellular death to the pancreas. Gallbladder disease, followed by excessive use of alcohol, are the leading causes of injury to the pancreas. Trauma, drugs, infection, metabolic disorders, and postoperative GI surgery can also activate pancreatic enzymes or cause injury to the cells of the pancreas rather than the intestines. There's an accumulation of bile acids that are introduced to the ducts of the pancreas through a distended sphincter or by gallstone blockages. And then again, that accumulation of bile acids can cause ischemia to the pancreas due to those obstructions. Activated trypsin can produce bleeding in the pancreas due to the enzyme's digestive qualities to the lining of the pancreas. And then in cases of chronic alcohol intake, the exact mechanism for pathophysiology is unknown. However, it is thought that alcohol increases pancreatic enzyme activity and production, which also has those digestive properties and can cause inflammation. So now I have a little experiment to show acute pancreatitis. So I will go through the demonstration and then I will show you the experiment itself when I performed it. So the supplies are a balloon, which signifies a pancreas, vinegar, which would represent alcohol, and baking soda, which represents the normal pancreatic enzymes or the pancreatic contents. So what I did, I have a bottle filled with vinegar and I have a balloon attached to the top, and in the balloon I have baking soda. So when I flip the balloon over, the baking soda and the vinegar combined and they react with each other. That reaction creates carbon dioxide gas, which inflates the balloon. So this is similar to acute pancreatitis when excessive amounts of alcohol are ingested into the body and interact with the pancreas and the pancreatic enzymes, which causes the pancreas to inflame. When I did this experiment, I did it outside because I did not want to risk having an explosion in my living room. It was a little bit windy, so bear with me for the sound quality. All right, this is the vinegar, baking soda, and balloon experiment to show acute pancreatitis. So I have vinegar in the bottom of this bottle here, and then I have baking soda in the balloon. So I'm about to combine them. And the balloon inflates. There's carbon dioxide gas up here. And again, this shows the interaction between the baking soda and the vinegar. Just like in the pancreas, it would show the interaction of alcohol and the pancreatic enzymes to inflame the pancreas. And it keeps growing. Again, just a visual for you. And then this image here shows the final result of the experiment. So the balloon inflated quite a bit here. That brings us to some risk factors. So we have smoking, again, that excessive alcohol intake, elevated serum lipid levels, and that high-fat diet. African Americans are actually 3 times more likely to develop acute pancreatitis compared to Caucasians. And I found an interesting study published by Ethnicity and Health that found that one's ethnic lifestyle can actually contribute to the development of pancreatitis. So this study focused on Taiwanese Aboriginal women, and it showed that those women actually had an increasing numbers of alcohol-induced acute pancreatitis due to their cultural background. So these women were found to have a lot of stress in their daily lives when it came to the hardships experienced by farming, pressure of raising children, and providing childcare. These women had alcohol readily available to them and would self-medicate, therapeutically self-medicating with that alcohol. And as we know, alcohol irritates the pancreas and leads to the development of acute pancreatitis. Some clinical manifestations and assessment materials. So again, the key signs are that severe radiating abdominal pain and tenderness to that left upper quadrant region. It's described as piercing, deep, and continuous pain, aggravated by eating that is not relieved from emesis, and the pain can coincide with dyspnea, cyanosis, and flushing of the skin. So dyspnea, that trouble breathing, cyanosis, bluish tint to the skin, and then flushing. Nausea and vomiting could be present, low-grade fever and jaundice, hypotension and tachycardia, decreased bowel sounds with or without abdominal distension, crackles upon lung auscultation, and then we have gray Turner spots and Cullen signs. So the difference between these two, they both have bluish discoloration, but the gray Turners occur over the flank region, and the Cullen sign occurs in the periumbilical area. This results due to a blood exudate being released from the pancreas, and this indicates a severe case of pancreatitis. Now we have some complications. So the severity of the pancreatitis, it really depends on the degree of damage that occurs to the pancreas. So you could recover fairly quickly, you could have recurrent episodes of acute pancreatitis, or you could actually have the development of chronic pancreatitis. A complication that could occur is a pancreatic pseudocyst, which is an accumulation of tissue debris, fluid, and pancreatic enzymes surrounded by a membrane barrier. This is manifested by a palpable epigastric mass, abdominal pain, nausea, anorexia, vomiting, and an elevated serum amylase level. An MRI, CT, and endoscopic ultrasound could be performed to diagnose, and then this may resolve on its own, or it could perforate to cause peritonitis. Again, when this perforates, this releases that debris, fluid, and the pancreatic enzymes, which could release bacteria into the peritoneal cavity to cause an infection and irritation to that lining. There could also be an abscess, which is an accumulation of pus from necrosis to the pancreatic tissue, which is manifested by an abdominal mass with upper abdominal pain, leukocytosis, and a high fever. This requires urgent drainage to prevent further complications of sepsis, or that blood infection that can take you down pretty quickly. Then we have some systemic complications that can affect the respiratory system as well as the cardiovascular system. So we have pleural effusion, pneumonia, atelectasis, acute respiratory distress syndrome, and several cardiovascular changes. Pancreatic enzymes pass through that peritoneal cavity, and that causes inflammation to the diaphragm and leads to those respiratory complications. We also have the enzyme called trypsin, which activates plasminogen and increases the risk for thrombosis. So upon assessment, looking for those DVTs, pulmonary embolisms, things like that, because of the increased ability of the blood to clot. Some diagnostic studies. So we have a couple lab values that we really want to pay close attention to. We have serum amylase that may elevate, serum lipase could elevate, blood glucose elevation, serum calcium could decrease, serum triglycerides or fats may increase, serum bilirubin increase, and urinary amylase increase. Imaging studies, we have abdominal ultrasounds, x-rays, CT scans. And CT scans are the best are best used to visualize the pancreas and for underlying complications, as well as those pseudocyst and abscess formation. An angiography to look at the blood flow to the pancreas, and chest x-rays to diagnose any pulmonary complications, like we discussed the pleural effusion, atelectasis, things like that.